Conversation about mental health first aid. My name is John Castan from PSCH, which, along with its partner, Pedersen Craig Center and Peninsula Counseling Center, provide comprehensive range of mental health and chemical dependence and other behavioral health services across Long Island and New York City. And we're very happy to present this first in what will be a continuing set of web chats on key subjects in mental health and chemical dependence and other behavioral topics that may be of interest to a wide variety of folks, both within the business of behavioral health as well as folks in general who may be interested in the topic. As I mentioned, we are a group of 3 agencies that are partnered in providing high-quality, comprehensive care to individuals across the lifespan and across the diagnostic and functional need areas in behavioral health. We've been at this for many, many years, and I'm joined by 3 experienced professionals, Carrie Besserman, Wayne Gurnick, and Robin Krajewski. And they're going to be talking about a really important development in the public health side of mental health, namely mental health first aid. And mental health first aid is something that's they'll talk about in much greater detail, but is very much tied to an effort and attempt to bring early intervention and assessment and prevention to the mental health field, much like is done in public health around communicable diseases and other kinds of medical issues. And with the emergence of the last 15 or 20 years of increased concern about access to mental health and chemical dependence services, laws that have recently passed to improve the parity of insurance coverage for those conditions, and a general consensus that issues like stigma and discrimination keep people from getting the services that they need, and that those services can make a huge difference in their lives. Mental health first aid is a really remarkable and important new intervention at the community level. So I'm going to first let Wayne, Carrie, and Robin talk a little bit about what mental health first aid is, and they're going to talk about how it is delivered as a curriculum to individuals who seek training in mental health first aid, and how it can change the lives of individuals who are touched by it. Just for background, PSCH and its partners, Pedersen Craig Center and Peninsula Counseling Center, are all not-for-profit organizations. As I mentioned, have been providing services in the community for many, many years, and quite honestly, really depend on the generosity of individuals and families and corporations to help us do the work we do. We certainly receive reimbursement for some of the services we provide and support from government, but in fact, we are very much grateful for any support that folks can give. I believe you have a donate button on your screen, so if you are so moved, we would really appreciate your support. So having said that, I am going to hand things off to Robin Krajewski.
Thank you, John. Despite the fact that I'm here. Can you hear me? Okay. Despite the fact that you talked about
yes.
John can't hear me for some reason, so we'll get that corrected, but I'm going to go on. So John mentioned many of the advances that have taken place in mental health, but unfortunately, stigma is still an issue. And most recently, the National Council for Behavioral Health, cited the fact that there are over 8 million adults and children living with mental illness and addiction disorders in the U.S. So these people need to know that there's help out there, that they can and will get help. And, how do you do that? And how can each and every one of us help in that quest, or help them move towards seeking the help that they may possibly need. So what we've chosen to talk about today is one of the many opportunities and programs that we offer in our network, and that is mental health first aid. So I know all of you listening, probably the first question you have is, what is mental health first aid? So I'm going to ask Carrie and Wayne to discuss that a little bit.
Good afternoon. Mental Health First Aid is a program, an 8-hour curriculum that really focuses on training folks from the community to provide initial help to whether it's young adults or adults who may be experiencing different levels of involvement with mental health issues, whether it's the beginning of a short-term mental health challenge, whether it's a developed mental health disorder, or an actual acute crisis situation. Mental health first aid prepares folks to be able to bring the initial stages of support and help to folks prior to professional help being available and prior to other supports being put into place. As we know, when mental health issues emerge, oftentimes professionals are not available on hand. And so it's very important that the community and folks are trained in mental health first aid to be able to provide that support. I think that one of the big points of mental health first aid is that it is not training people to diagnose mental health disorders. It is not training people to provide actual formal treatment of mental health issues, but really providing those initial stages of support.
One of the other things about mental health first aid, to put it in a concept that people really sort of already understand, is that as a community, we already have other first aid systems in place. Everybody is comfortable with hearing about American Red Cross and doing CPR and emergency first aid and basic first aid classes, and it's not unusual to hear that. What mental health first aid does is the same concept of having someone who can just be a lay person or skilled, it doesn't matter, have the basic knowledge to help someone through the immediacy of an issue. So just as you would say, if someone, you had never been trained in doing helping someone who's choking. Now you go to first aid class and they teach you the Heimlich maneuver, and you're still not an expert, but you are able to provide some initial assistance. Mental health first aid is a course designed for adults and or youth to help that everyday person be the conduit to care for someone who might be in some type of crisis. And in this case, we're talking about symptoms related to a mental health issue.
So, when folks in the community may face a medical crisis, if they do not have CPR training or first aid training, they may shy away from the situation and not provide assistance. And I think what we're looking at with mental health first aid is getting folks comfortable with the idea that they can recognize signs and symptoms of emerging mental health issues or a crisis situation and take away the mystery of what that is all about. So the program really helps people to understand what a mental health issue is and how to begin to approach somebody who may be in need and provide that kind of support. It really is meant to demystify the whole notion of mental health issues and to begin to break down stigma that often creates a situation where folks are fearful of a mental health issue or will not initiate support or help to somebody who is in need. As we had discussed, mental health first aid, there's two programs. One is an adult component and one is a youth component. And the adult program, which Carrie provides training for, addresses working with adults who are dealing with mental health issues. I do the training in helping people to understand issues particular to youth, ages 13 to 18, with mental health issues. And I think it's important that a youth component was developed to mental health first aid, because oftentimes young people are not aware that mental health issues even exist, or that there is help when they're facing some type of mental health challenge. And so it really brings to the forefront in the community that young people, can become more comfortable with the notion itself that mental health issues do exist, and that there is help out there, and that there are ways to access that help that may not be on hand at the moment.
Okay. We have 4 trainers in our network, 2 for youth and 2 for adult. What the National Council has just begun another segment of training, and that is for veterans. We haven't addressed that yet, but that's something that I would like everyone to know about, that is available. So, Carrie and Wayne, who exactly are the target audience for this kind of training?
Well, Robin, one of the things that's really neat about the mental health first aid curriculum is that everyone is literally a target audience for this curriculum. It's a community-based, it's family, it's coaches, it's coworkers, it's everything, because we're talking about anyone who comes in contact with another person. And since we don't know each other's stories before we meet somebody, or we're shopping in a mall, this type of a skill goes with you wherever you are. And then it's a knowledge base. So the target audience, you might say Wayne will talk a little bit more about the youth, but for adults, what we talk about is anyone where you have an opportunity to be with someone else to make a difference and be that presence that can make a difference between a crisis and bringing someone down from what we call a tipping point and helping them through that moment. So it could be your local community. If you have churches, you have community groups, you have your coworkers, like I said, in the office building. I mean, the idea is that anyone who gets trained, and I liken it a lot to regular first aid for physical health, anyone who has an opportunity to feel comfortable to help someone else is the target audience.
So, as Carrie said, anybody who, has an interest, we're really eager to have trained in mental health first aid. I think with youth, it's really imperative that folks who are in regular contact with youth get trained. And we really are looking to train folks who are coaches, who are teachers in the school system, correctional facilities, religious organizations, community youth groups. These are folks who are generally in regular contact, and maybe that person, that young person actually will speak to, will kind of indicate that something's going on in their life. When we think about 1 in 5 youth, between the ages of 13 and 18, that's over 20% of young people in that age will have a mental health disorder. That significantly impacts their functioning. And when we're talking about functioning, we're talking about their school performance, their ability to relate and to be in meaningful relationships, to carry out just their daily activities. And when we think of young people in that developmental period of their life, this kind of impact can really shape the rest of their life. And so it's very important that folks in the community are very aware of signs and symptoms and what they mean when they're relating to young people. As a matter of fact, a half of all lifetime cases of mental health disorders will appear by the age of 14. So by the age of 14, half of all lifetime cases of mental health disorders will be present. And so I think it goes to the point that folks who really are involved with young people need to know what to look for and how to begin to speak to a young person about issues like this. By the age of 24, 3/4 of mental health disorders will have emerged. And so we see that in young adult population and youth population, these disorders, these mental health issues do exist. And it's important for the community to be aware and to be in a position to help, as professional help, again, is often not on hand. And mental health issues oftentimes show themselves very differently in young people than adults. And so hence the need for a very particular curriculum for adults and for young people.
Thank you very much. Can you tell me a little bit about how this program was developed and maybe a little history behind it and why it's so critical to be able to offer this?
Well, Wayne, why don't you talk a little bit about the history, and then I'll talk a little bit about why mental health first aid.
Okay. Mental health first aid started in 2001, and it started in Australia, actually. And Betty Kitchener and Anthony Jorm were the founders of mental health first aid. And I'd like to read a quote, which was their vision of mental health first aid. And what their vision was to create an empowered community, providing support to one another in times of mental health problems and mental health crises. And I think that really captures why mental health first aid was developed, so that we have a community that can support folks with mental health issues to be comfortable with dealing with mental health challenges, mental health disorders. In 2008, the National Council for Behavioral Health, in conjunction with the Maryland Department of Health Division of Mental Hygiene and the Missouri Department of Mental Health, brought mental health first aid to the United States. In 2012, it was recognized by Mental Health First Aid USA, which was the adult component, that there really was a very strong need to target the specific particular needs and issues of young people. And so in conjunction with the experts at Georgetown University, actually the National Technical Assistance Center for Children's Mental Health, they came together and developed a curriculum for young people. And so this program, is fairly new. But since 2008, in the adult component, over 100,000 people have been trained in the United States in mental health first aid. In states such as Missouri and Maryland, where the program started, it is throughout the community. There are folks trained, in every aspect of the community. And it's in government funding. And I think in other states such as California, they've been picking up. And across the state, it's becoming across the country, it's becoming a bigger and bigger initiative. And it has been backed by President Obama. New York State recently has begun to put in funding with school systems to partner with providers to provide this type of training to school personnel. And I think that's critical. As we all know, there's been a lot of school incidents in the United States. And so this is becoming bigger and bigger. And, we will see this across New York State, I believe, in the next year or so.
And the reason we talk about, you say, so why mental health first aid? All those reasons we've been talking about so far, reading the newspapers and hearing the news recently. And the
so, Robin, do you have any more questions for Wayne and Carrie?
Well, actually, I think Carrie is just telling us a little bit more about the history and how it was developed.
All right, so the reason that we talk about mental health first aid is actually because mental health problems are common. There is stigma related with mental health problems. People will shy away, it builds up an issue. Mental health first aid helps with that. Many people are not well informed about mental health issues. And as Wayne was saying, the professional help isn't always on hand. And folks don't know how to respond. So this type of a class brings a comfort level and normalizes who we are as people and the people around us to a situation where we can all be a useful tool. But I always use the phrase, "it's more tools in your toolbox," because this gives you a skill set, a comfort level to be able to engage another person. So mental health first aid gives you an opportunity, the course gives you the opportunity to gain a basic knowledge base, to give you a comfort level that you may not ordinarily have based on day-to-day life and activities. As Wayne was mentioning earlier with some of the statistics, particularly with the youth, they were saying how they're diagnosed at youth and disorders can stay through adulthood. You have to remember the vast majority of individuals walking around this earth are adults. We're bound to meet people who have all sorts of conditions that we may not be aware of when we first see them. And in order to be prepared to be a helper, this is one other way and one other tool to do that. And that's what the mental health first aid does.
So could you tell us a little bit more about what you cover in a course for mental health first aid?
I think one of the first things that I'd like to say just about the course and what's covered in the course is that
Linda Bajenski, please call 7601, Linda 7601.
The course really is respectful of people's roles in general. And so folks come to the mental health first aid in many different types of roles. As we said, they may be folks in the school system, in the correctional system, juvenile justice system, people, in the community in many different roles. And so the course, throughout the course, is very respectful of really having people understand that the policies, procedures, guidelines of their primary roles are critically important and are maintained in instituting the mental health first aid program. What comes to mind when I think of mental health first aid and somebody in the community considering whether they want to take this program or not is the comfort level in, how will this impact what kind of role I'm in the work that I do, perhaps. What are my limitations? What boundaries do I have? And so these kinds of issues are discussed throughout the mental health first aid curriculum. The mental health first aid curriculum also brings to life situations that folks may deal with in their particular roles. So we use role plays and scenarios and even simulations of mental health issues throughout the program to bring to life for people who are in the training the experiences that they may actually have. So whether it's a teacher who's dealing with a child in their classroom who seems to be withdrawing, who seems to appear sad, whether it's a youth group leader who's really seeing some angry reactions from a youth who may be being bullied and there's rumors of bullying going on, whether it's a parent who sees their young person, their child, who all of a sudden is disengaging from their goals and from even, say, the college process. So what we do in the program is there's a didactic piece to the program in identifying different signs and symptoms and interventions and ways to assess situations. But the role playing and the simulations actually walk people through the dialogue that may happen with a young person and in the adult situation with the adult. And actually, live that out and develop those skills. And so it's a very powerful experiential training in dealing with mental health issues. I'm sorry.
Okay.
The mental health first aid, again, does not train somebody to diagnose or to treat. But we do go over common diagnoses so that folks have a general understanding of mental health issues. Carrie?
Well, one of the things I'd like to talk about with the class as well, and same thing with adults, is we did talk a little bit about the roles, and you might have different audience members. So what mental health first aid has done is it's taken some information that they want to share, has general overview, there's different types of sessions. As Wayne said, it's an 8-hour course for someone to participate in because it is considered a very tight curriculum base. There are rules that we have to follow and guidelines and materials that we present. So it could be an 8-hour straight, or it could be 2 4-hour days for the course, but it is an 8-hour curriculum. And in that curriculum, they highlight certain things that they want to address, regardless of whether it's an adult first aid or the youth first aid. There are certain things that they want to make sure the audience understands, which is the basic things. Some of the things we already started talking about ourselves, like what is mental health first aid? Just the basic. Why are we even here? The mental health problems in the United States, and they're more and more prevalent, being noticed because they're in the news. So that discussion happens. Understanding, basic understanding of some of these symptoms. What is an illness? Is mental illness something that always happens? Do you recover from mental illness? Those are things that we touch on because that's important for people to have an education about. We talk about an action plan. What do you do when someone is in front of you and you're witnessing something that appears to you to be an unusual state? Is that person in crisis? How do you approach somebody like that? And we do an action plan so that it becomes automatic. And we practice that in the different role playing that we've talked about that Wayne had mentioned. And even within that, we make sure we understand that it's within your role. So for an example, if you have people with protocols for, let's talk about what we're used to doing as a society. If someone's in crisis, we call 911. We're not really sure. We look for help. We get that emergency person. That person comes with a protocol set. They know what they have to do. What mental health first aid does is recognizes everybody has these things that are attached to what role they're playing and incorporates these extra tools and these methodologies to allow them to move forward and be assistance in that crisis. We talk about understanding certain diagnoses, again, not diagnosing, but if you hear a common term or if someone says to you, if you're asking someone if they need help and they're saying, oh, I have, it's not something that you're going to say, oh, I have no idea what that is. You're going to get, okay, so the symptom of that might be, and you're worrying more about the symptoms and everything. And then we talk about a little bit about even substance use disorders, and we talk about the first aid action plan. And again, everything on this is about safety. Safety for the person in crisis, safety for the people around them, and helping the individual that is having this event avoid having to get to the tipping point of whatever that decision or tipping point might be, whether it's harm to self, harm to others, or just getting through that moment.
With the youth mental health first aid, I think one of the important pieces of the curriculum is really distinguishing between adolescent development that's typical and what is now becoming a particularly an issue or a problem. And so in the curriculum, we go over many different aspects of development, whether it's physical, emotional, behavioral, thought processes, in a very detailed kind of way, actually, to help mental health first aiders distinguish whether something is actually an issue, becoming an issue, or is more of typical adolescent development. Because, listen, typical adolescent behavior oftentimes can look like a mental health issue. Withdrawing from family can look like a mental health issue, but that's also part of typical adolescent development. Withdrawing from the family to spend more time with the peer group, to spend more time with friends. And so it's important for mental health first aiders to really be able to think about and distinguish, is this an issue or not? Mental health first aid doesn't want superheroes coming in and kind of addressing every mental health issue that may or may not exist. It's really there so that people can really take a look, begin a dialogue with a person, and begin to provide that support and to continue to assess. Part of the action plan that Carrie talked about is continual assessment of a situation, whether it's in a one-time situation with a person or over a period of interactions with a person. Adolescents like privacy, and so their level of privacy, goes up. However, if a youth becomes extremely secretive and seems to have this driven need to have privacy, and they're shutting everybody else out, now that's a situation where mental health first aid may come into play. And so, these kinds of dialogues and discussions with the participants become very lively. And one of the conversations that occur are risk factors versus protective factors. What puts somebody at risk for a mental health issue, and what creates resiliency? What creates the ability to kind of counteract some of the stressors or predisposing factors to mental health issues. And these discussions become very lively in the curriculum. Things like how much monitoring of a young person is important in keeping a child healthy in the mental health sense. And that becomes a very strong dialogue, with parents and different perspectives, but we know that monitoring and pretty close monitoring of youth's activities is a protective factor for mental health issues. So these things come out in the training, and I think, provides very lively, individualized discussions based out of the material.
Thank you. Go ahead, Karen.
The last piece, Robin, I just want to add is that because of the concern that people with mental health problems often do not seek help, often they don't recognize their issues until it becomes so inhibitive, until it actually becomes a disability and it disables functioning and affects their ability to impact their daily life schedules. So having this skill set and understanding all these little components, and especially things that Wayne was talking about, it helps to get people guide them through this illness, to this illness period, and get to the assistance that they need in order to have a different stabilization of wellness in their life. People can live successfully with mental health issues with correct support and understanding that they're even having them.
One of the aspects of the mental health curriculum in both the adult and the youth component, that's a very important and serious one, is suicide assessment and talking to folks about whether they are having thoughts of killing themselves. And of course, that is a very uncomfortable situation for people to deal with. And oftentimes, people shy away from that. And so there is a very big component discussion of the risk of suicide or the risk of harm, self-harm in general, and how to begin that dialogue, how to assess somebody and how serious the situation is, and whether it doesn't reach the level of an emergency, and that we can provide support systems in place. And so part of the program really talks about within your own community what is available, what supports are available, what social supports are available, what community-based programs are available, because oftentimes we don't need to go to the highest level of intervention. And so, there is a continuum of services that are discussed, particular to the community that the training is occurring in, so that people who are trained know where to turn themselves, know where to guide people to go, depending on what type of issue that they are experiencing. Whether Carrie said it's a substance use issue, whether it is an issue where suicide is at high risk, or whether it's just a particular short-term challenge, stressor that somebody's going through. So the program really talks about what the resources are as well.
And the piece that I'm sure is on everybody's mind is what about, so we talked a little bit about harm to self or suicide, but also obviously harm to others. The course also talks about recognizing signs and symptoms and how to reach out for help and to help someone who is expressing themselves in a way that, do we count this as a concern? Do we believe that this is a risk? Is there a threat behind this? What do we do if we perceive it to be? So we can take an action, and not just for the individual that might be made in the statement, but for safety. So we do talk about that and making that assessment and knowing what action to take. It's part of the action plan. Say, what do you do with that information once you have it? And what it does is it creates a safer place and a safety plan for those who might find themselves in that situation. And it can make a huge difference. The other thing is that how many times we talked about issues where someone said, if someone had just come up to me and just helped me through that moment, I might not have hit that tipping point. What we want to do is practice starting that difficult conversation and making it less complicated. The more we normalize these types of discussions and understand that people have different feelings, the less extreme responses will be, because they'll be heard much sooner. So part of mental health first aid is not only a safety plan, but it's a suicide prevention plan, which is devastating for all of us when there's a situation like that. It's a prevention plan to reduce risks of self-harm, whether self-injury or otherwise, and it's a community safety plan because it's a way to prevent harm to others.
Thank you very much. So how effective is this training? I mean, does it work? And did you get any feedback from any of the training that you've done so far that you would be willing to share with us?
Well, with the youth curriculum, we've done a number of trainings and have gotten feedback from folks who are in the training, just as a kind of debrief at the end of the program, and additionally after the fact in, how this has impacted them. And I think for the most part, what we hear across the board is really just more of a comfort level in actually identifying whether there's an issue with a young person or not. Really kind of honing in on, this is probably typical adolescent behavior, but no, I really need to kind of step up and talk to this young person about what I'm observing and what my concerns are. And so, from folks that we have trained, we hear that it has actually impacted their day-to-day work, whether it's, paraprofessional staff that we've trained, supportive type staff, or folks who are interns and just starting out, particularly, in the social work or related field, that they've really brought a lot of these skills to their work and to their interactions with young people. There's been a number of randomized control studies. Many of those studies are based in Australia, where the program started. A lot of research has come out of Canada. I'll comment on some of the youth research. And I think, in the studies that we've reviewed, the biggest impact of this program across the studies is a real reduction in stigma and a real reduction in the discomfort of dealing with a mental health issue. And with that, an increasing confidence in actually providing support or intervention when it comes to a mental health crisis or a mental health challenge that is being experienced. I think that some of the research has shown that one particular study has done a 6-month follow-up, and that the gains in decreased stigma and increased confidence in dealing with mental health issues remain. And so it's not a short-term effect. It's an effect that stays. Some of the indirect research findings that were not intended but were found, which I found very interesting. In a school setting, there was a research study in Canada in a school district. And they found the reduction in stigma. They found more of a greater understanding of mental health issues in youth in this study, and understanding of what treatment options there were for young people in the school. But what they found was, compared to a control group, that the young people in those schools identified that they got more information about mental health issues in general and emotional difficulties than the control group young people. And so that wasn't intended, and that's not the focus of this program, to disseminate information specifically in that way. But what we learned from that is that when folks are part of this training and become more comfortable themselves, they're more willing to discuss and share the concepts. And that really leads to what this whole intended purpose of this training was. And that's to provide a community of people who are more comfortable and willing to support each other when these difficulties arise. And I think the studies really show that. And I think that's exciting for mental health in the United States in general.
There's a very strong parallel with how things are moving forward with mental health first aid, whether it be adult or youth curriculum, as with the introduction of standard basic first aid happened, and we started training people in the community on those basic safety factors. And the idea, again, I know I'm repeating myself, but I think it's important to understand that we're preparing people to deal with people and see where they are and how to help them through that moment of ill ease, whether it can be, something that people have heard the terms before of a panic attack. It doesn't mean that it's an emergency crisis situation. It's the moment. So it's learning how to be present in the moment, addressing a situation at that time. And we all know that when we've learned to handle those moments, the next moment becomes a little bit smoother so you can get past it. So with this curriculum, what they're finding is that as long as it's taught to the fidelity of the program, and we continue to honor the basis of which it was created, there is no downside. There's absolutely no downside.
Well, thank you very much. I see that we have a couple of questions that have come in, so I'm going to just pose a few of those to you, if I can find them again. There was one here. Okay, is bullying the number one issue facing children and affecting their mental health? And I guess basically at what level? Is it elementary, middle, or high school students? I don't know if that's anything that we've covered in the training at all.
It's not covered in the training, and again, I think it is a huge issue. Bullying is a huge issue, and is oftentimes the precipitant to suicide with young people. And so, understanding and identifying and dealing proactively and aggressively with bullying is important to mental health with young people. As far as age goes, I think it's across the age spectrum. Again, this course doesn't specifically target the issue of bullying, but I think it's a great issue to bring up related to mental health issues and suicide prevention with young people. I think, as we've moved on in the last several years, there's been a lot more initiatives that PK has even been a part of in bullying prevention. We have a youth leadership organization here called WAVE, where our young people developed a whole, a WAVE rally, and got young people to provide testimonials of their own experience, not only as bullies, being bullied, but also as bullying and what the emotional impact is. And I think that, with really being able to, particularly in the school settings, to identify that bullying is going on is critical. I think that this is where one of the aspects with mental health first aid training comes in, is that right now, youth mental health first aid, sometimes people think that it's for youth. It's not for youth, it's about youth. But there are trials going on right now for adolescents, older adolescents, 16 and up, primarily 16, 17-year-old, 18-year-olds, to see the effectiveness of this mental health first aid training with that population and where the program may need to be modified to meet that particular audience. Because as we all know, youth often go to other youth when in need. And so for young people from a peer-to-peer to be able to support a young person or guide them to help, particularly when they're in a situation with bullying, is critical. So we're very excited about that development and that would move forward. And I think that will address, a big part of the bullying issue, where a young person as a peer may understand what's going on, but adults may not see it.
Very good, thank you. Okay, this jumped. I had a question right there. Okay, because of the negative stigma towards mental health, how much longer do you think it will take for mental health-related careers to develop so that mental health patients can get the help they need? Anybody want to tackle that one?
One of the things I would talk about is that I think we actually have.
Robin, I'll try to address that a little bit. I think it's a really.
John, just let me say something here. To those that are listening in, I think some of us aren't hearing the others. So that's part of the conversation that's happening here. So I apologize. I don't know what, technically what's going on. So we'll do the best that we can. So John, I think Carrie was just going to mention something, and then I'll turn to you if you don't mind.
That's fine. I didn't realize she was speaking. I can't hear her. So.
Okay, Carrie.
Yeah, I got a little lost on that train of thought there for a second. Sorry. I believe that what the point I did want to talk about is that a lot of times now the focus is on the kids who have been the victims of bullying, and where does that go? So I want to just touch on that part that Wayne had said before. But as far as where the field is and what's happening, I think part of that is that there are resources that are out here now that people don't understand or aren't aware of how to access them, or access is difficult. There's a lot of movement, particularly with getting assistance, substance use disorder. There's movement in New York State to get better access, mental health parity for making sure that people have benefits to get access to care. So I think it's more than just when will we get more professionals. I think there are professionals there. I think part of it is also about access. And as far as getting expanding the resources in the field, that becomes more of I dare I say, more of a political hotbed on how we are finding funding and resources for providing these services. It's a challenge in itself. It's very difficult to maintain high-level quality care in some of the dynamics that we've been set up to run operations. So there are services. I believe access is probably more of a challenge for folks because they just don't know how. And if we made that an easier way, we'd be able to help more people.
Okay, John, please, if you'd like to add something.
No, that's fine. Why don't you get to some of the other questions?
Okay. The mention of resources, and I'm going to do a plug here a little bit for the fundraising. I just wanted to, remind everyone that all of us that are represented here, we're not-for-profit organizations, so we do rely on, some state and federal funding, but we do rely heavily on donations that we get throughout. So just a reminder on that. Let's see, so we did that one. Let me get to, we did bullying. There's something about the tragic, I'm having a little trouble scrolling through these, so I'm really sorry. How are the tragic gun violence cases in school and mental health interrelated?
Well, if you consider a lot of the news reports, it's also, you have to remember, for speaking on the side of we are shared information over a public venue, what information we get and at the speed we get it. And for a lot of folks, the connection is being made because we're having extreme reactions and causing extreme results. And that's what's being played out, unfortunately, in many places right now. What we're finding is that in some cases there is report that there is an interrelatedness. There might be some illness attached to it, but it's really more important to note that there are far more people living successful lives without violence and without injury to others and injuries to themselves with mental illness. And that's why this course is particularly important. The other thing is that maybe some signs, like Wayne was talking about earlier, were missed, or something that we can do at that moment that changes that action from happening if we are prepared and comfortable with knowing what to do.
Yeah, I think one of the points, that we discuss in the training, and I think this is where it's important with mental health first aiders, is that one of the most powerful protective factors with suicide, violence, what have you, is one very significant adult person in a young person's life. And that's probably one of the most powerful protective factors. And there's a lot of political issues related to violence, gun violence, and what's happened across the country in schools. But I just like to go back to, early recognition, early identification of signs and symptoms, and that anybody can be that one person, that one important adult in a young person's life that actually changes the course. And is able to access services. And again, we know that there are a lot of this is a political hotbed issue. There's discussions and controversies about access to care and privacy issues. But from a preventive standpoint, from early on, I think that's where this program comes into play, and to be able to identify some of those early signs and to begin to get that help. We know that 50% of people take 10 years to access any kind of help for mental health issues. 10 years. That means 50% of people with a mental health issue take longer than 10 years to get help. And so we know that the sooner we get help, the better the outcomes. So this early identification, early intervention is really just critical in really changing what's happening across this country, I believe.
Thank you. Well, we're rapidly getting to the 1 o'clock point here where we have to end this chat. So, John, I wanted to ask you if there were a few comments you wanted to make to close this chat for us.
Sure, thank you very much. Well, first of all, I just want to thank Carrie and Wayne and Robin for presenting and speaking. I want to thank those of you who logged in and participated with your, and including your questions. I want to thank Vonvo for hosting the chat, and I think clearly the response that we got suggests that in the future we can organize other of these events on related topics. There's clearly a tremendous interest for this. People have a lot to say about it, and I think we all can learn more from it. I think it's a really good kickoff as far as presenting something that really connects to the community very concretely around mental health first aid, and really is something that I think shows the kind of the leadership and the forward thinking that our organizations, PSCH, Medicine Craig, and Peninsula Counseling Center have about how to carry out the mission that we hold. Again, one more time, just to remind you, you can go to each of our websites, psch.org, Medicine Craig, and Peninsula Counseling Center, if you're so moved to donate and supporting us. And in the future, there'll be other opportunities to have these kinds of discussions. And we look forward to the day when some of the technical glitches that we faced get resolved so that the next time this goes a little bit more smoothly. But I want to thank everyone, and with that, I think we'll log off, and we'll look forward to seeing you next time.
Okay, thank you.
Thank you.
We're just going to add, I'm going to ask Carrie or Wayne to add in the text chat the website to access any more information you may want on mental health first aid.
Terrific.
So thank you.
Thank you.
Thanks, everyone.
You have it, Wayne?
I'm not quite sure.
Okay.
Yeah, I'm sorry. I'm having a difficult time figuring that out.
Okay, so it's I could put it in. Does anybody have it in front of them?
Yes, www.mentalhealthfirstaid.org.
I'm typing it now.
Thank you. And if anybody would like additional information, particular training out of Pedersen Craig Center for the adult program, you can email Carrie at CBESSERMAN at Pedersen Craig, PEDERSONKRAG.org. For the Youth Mental Health First Aid Training, you can email myself at WGURNICK at Pedersen Craig, PEDERSONKRAG.org.
Okay, and we're going to add that right now to the chat.